How's everyone doing today? It's a big day. All right, so let me just get this adjusted a little bit. Okay. All right, so welcome. Today's a big day. I'm gonna be talking with Angelica or Candylover89. So anybody who has some questions, she's going to be getting her second procedure. So those of you who don't know Candylover89 or Angelica, she is the individual who popularized the term 360 lipo, and that's because she got such phenomenal results. And let's see if we can find her here. Hey, can you guys keep an eye out for Angelica on Instagram? See if we can get her on. So I'm going to be bringing Angelica on Instagram. I am live here on YouTube as well as Facebook. But if you guys want to actually see her image, you'll be able to hear her voice. But if you actually want to see her image, you can jump on our Instagram feed for My Shape Lipo. What's up, Ivory? Can you guys turn the air conditioning down, please? All right. What's up, everyone? Ivory, Marilyn. Appreciate you guys watching this. Okay. I know I just spoke with Angelica. There you are. Okay. She told me that she had to put on some makeup or something and had to look all pretty for this. What's up, Angelica?
Hi.
How are you?
I'm good.
Are you only showing us half your face?
Oh, why does it do that? I don't know why it does that. Okay, what if I flip it? Let me see.
There you go. Oh, now that you're sideways.
I don't know why it's doing that. Like, I see myself fully, but...
Oh, there you go. Better. Nice, you got a wig on.
In the middle. I don't know. It's hard to tell because I can see it, like, fully. It's weird. I don't know.
Okay. So how are you?
I'm good.
Good. Exciting. So, well, let's talk a little bit here about you, because I know that you've recently been in Puerto Rico and you're doing some stuff out there. So why don't you kind of bring everybody in on what you're doing there?
So basically, I've been recording my album. So I have 12 songs coming out soon.
Right.
And I am not ready to be fat during those music videos. So.
That's right. And let's do a little history. So, you know, you've obviously had a procedure at My Shape Lipo before. So why don't you kind of fill everybody in?
So I had my lipo last year, February 12th to be exact. And I don't know if you guys, can you see my body?
Wow.
So I had my stomach done, my sides done, and my back sucked out, basically.
Right.
And I looked really good for a while, and then I messed up.
Well, you still look great.
Thanks. But I've messed up. I've been very bad just because I let the stress eating take over, like, my willpower, I guess. That makes sense?
Right.
So I let that kind of mess up, right? Like, right here, I gained some back. Not a lot. Right. But, like, a little bit. I don't know if you guys can see it right here.
You know what's funny, Angelica, is it looks amazing.
Thanks.
But I think that it's just, this is your perception of how you know,
so
you know what I mean?
Right here, this little line was gone. And it's back. So basically, like, I told Trevor I wanted to go back to kind of redo this little area, this one here, because we didn't get to do the top of my stomach. I don't know if you remember, but we didn't do the top of my stomach, so I wanted to do these parts. And, oh, my butt, hold on. This here.
Right.
The, like, love handle thing. Yeah. Because I have a really small torso, so if I go like this, you can see how it, like, folds over. Right. Because I have a really, like, short torso, so, like, work on, like, the sides. Yeah. But my main thing this time at My Shape Lipo is these bad boys. Right. These bad boys. Yeah. Trevor, I don't know how you're going to do this.
It's going to be magic.
But he, honestly, I trust him 100% because when he did my stomach, I didn't think that my stomach would look this flat. Like, I thought, because I've seen other people that get like lipo and stuff, and I was like, okay, I'm gonna probably look smaller, but it's like all the chubs are still gonna be there.
Right.
Girls. When I looked down, I was like, oh my god, like I see my toes. I was like, no way. So that was.
Hey,
he did an amazing job.
Someone says, who did your work?
He did. My shape lipo did my work. So now we're gonna be doing this, and basically. Like just little extras.
Everything under the underarm, all the way up to your underarm and the side of the breast. You know how your breast, when you have larger breasts, the breasts kind of roll into the armpit area.
Yes.
And so they form that fold, that roll. So we call it the front bra roll, and it's basically the whole underarm. And sometimes you don't really have it, but sometimes those girls get like a fold in the front of their armpit there. Yeah. So I mean, you have a little bit, not too bad. So it's not much of an issue. But some girls get a fold there, so we can take care of that as well. But everything all the way up under to your armpit will be gone, which is going to be awesome. So anything under your bra, all the way towards the back, it's going to be.
See, like right here, how I'm standing, you can see like my entire.
Yeah.
Like I could cut it with scissors,
right?
If I want, you know. So I'm so excited. I was like, I need to go back, Trevor. I need you.
Okay, so I did my mom's arms a few years back, and when I was growing up, I always thought my mom was buff, because she had the same look as you. Is like when you put your arms down by your side, it kind of bulges out.
Yeah.
So it makes you look like your arms are bigger, and I thought she was just like tough,
Like
right? But then I started doing this, and when she wanted her arms taken care of, and now she has this like real feminine look to her because of the arms. So I think that you're gonna experience the same thing. And the cool thing is that you start to see that definition around the deltoid and definition of the tricep muscles, and what now seems impossible, you're gonna be blown away.
Yeah. And so you guys, this is happening on Tuesday.
Yeah.
So So we're going to be live on Facebook doing the whole lipo so you guys can see the entire experience. I'm going to be awake through it all. I'm going to be talking to you guys through it. Mm-hmm. I'm nervous. I'm so nervous. So I don't know, Trevor, do you have any anxiety medication that I can take? I'm so nervous. But I think it's going to be really fun. I'm going to be filming the entire recovery so you guys know everything. Like when I'm leaking, everything.
Yeah.
All the behind the scenes, because I know a lot of people always ask me like, how's the recovery? But it's different for everybody. So I'm going to show you guys how my recovery goes.
Right. Hey, did you, by any chance, did you do any other research to see what the other options were for you? Because, like in medicine, it's like the opinion is, you're going to get a different opinion with
like other doctors?
Yeah.
Yes. So that I was very, very like, I was looking at places like out of state, out of the country, stuff like that. But I decided I wanted to stay close to home, just to be safe. And then I noticed that you go the extra mile, and you don't just. There's a lot of doctors that will do the lipo, they'll suck out the fat, but they won't contour your body. Like they won't give you that shape that pretty much like every girl wants.
Right. And
that's what he does. And I was like, that's what I want.
Yeah.
And a lot of the places that I went to, they also said, oh well, you need a tummy tuck.
Right.
And with tummy tucks, like, that's dangerous. Like, they're literally cutting me open,
right,
taking off my skin and then sewing me back together. And then that scar is from side to side.
Yeah.
I'm 24. I didn't want that scar. I haven't had kids or anything yet.
Right.
So I wanted to get something that was not as dangerous, but that would give me that nice result. And honestly, like I said, he gave me a better result than I even expected, because I didn't think that my stomach would be flat and like this.
Right. And clearly you didn't need a tummy tuck, right? So I think that's one of the big misconceptions is a lot of girls. And first of all, anytime you go to the plastic surgeons are going to say you need a tummy tuck. So that's one of the big misconceptions that girls think they think there's no other option. First of all, so I think that the idea that it is possible to get the same result or similar results with the belly that folds over, it retracts back. And it's most people don't realize that.
My stomach would literally, like you guys, my stomach would literally like fold here. It was big. And same with here. Like when I would sit down, this would be here.
Right.
Like, it was a big belly, and
Right.
I didn't think he could suck it out, and I was very scared about loose skin.
Mm-hmm.
That's something everybody was always asking me about. Oh, do you have loose skin?
Right.
I really don't. Like, now it's just a little bit of fat again, but it's not like skin. It's just
right. It's nice and tight.
Yeah.
I mean, you're young. You're young.
No,
you haven't had any
so
kids,
tight,
right?
I think the first day I couldn't breathe. I was like, I'm not expanding like I used to.
Right. Yeah. So
I remember watching Candy's surgery. Yes, I did that one live too.
Yep. So with the arms, the alternative that the plastic surgeons recommend is the arm lift. Are you familiar with that?
It's almost like a tuck, right?
It's the same thing as like a tummy tuck. The same concept as they're like literally cutting away the skin.
And then they stitch it back in.
Yeah, but so you basically get a scar from the elbow all the way to the shoulder, and it's the same thing as a tummy tuck. The scars are horrendous, and they're terrible, and they're big and thick and purple and ugly, and so as with the tummy tuck, a lot of the girls, they get tattoos to cover it up.
Yeah,
you know?
I've seen those.
Yes.
But see, for my scars, and I see a lot of questions asking about my scars. Honestly, so we had 10 incisions, so that means 10 little holes. I can't find 10 of them anymore. So I'll show you like the ones that I do know that I have still, but if you take care of them, honestly, they will disappear. Like, for example, I don't know if you guys, that's a mosquito bite here, but the scars right here, it's like a little.
Yeah, it's tiny, right?
The mosquito bite is bigger than my scar, so you guys can like get a better idea there. This one is gone.
Right.
I don't even see the little hole anymore. It's somewhere there, but you don't see it. I think we went here. Is one more little dot.
Uh-huh.
When my boob goes down, you do not see them at all, you guys. And then my back.
Yeah, that's by design. I try to put these in areas where they're
My phone just died. There we go. I got it.
I try and put them in areas where they're less visible. Like under the breast. Typically, the breast will sag down and cover up. But the reality is like most people, they fade away within a year. You can barely even see them. They change back to your normal skin color. So I haven't had a complaint about scars for I don't even remember how long. It's been a long time.
No, I don't even see. Like I said, I had 10. I think I can find maybe 4 dots.
Yeah, that's awesome.
And you can't even see them really at all.
Right. So
that's nice.
Talk about it a little bit. It's been, how long has it been now? Was it a year?
A year and a half.
Okay. So talk a little bit about how it's affected you, more of like on a personal level and like your confidence, and then also how that's translated into your business. And
so first of all, I threw a lot of clothes away. I didn't throw it. I donated it, but I got rid of a lot of clothes that just like they made me look so squared because I would try to hide my body all the time. Like I would wear the baggiest stuff I could find, and now like I wear my little high-waisted jeans all the time, little crop tops, and I'm just like, yeah, that's me.
Right.
And even with work, like I'm talking to Savage X Fenty right now, which is a big, huge brand. And they're interested in me like modeling some of their stuff, which is really cool. So I got a lot of more opportunities in the fashion side other than the beauty side, because I know I work with a lot of makeup brands, but now a lot of clothing brands are trying to reach out because I'm still not thin.
Right.
Even with lipo, like I have curves.
Right.
So that's just my body type. It is what it is.
Yeah.
And now I want to embrace them, but I don't want to embrace the parts that I don't like of them, if that makes sense.
Sure.
Like this here, I don't like this, but like I love my legs the way they are. I know I talked to Trevor before. I was like, should I get my legs? But I don't have a problem with them. I'm okay with my legs being big. That's fine. But I feel like everybody likes that shape, just that pretty cute little petite shape where you can wear whatever you want and feel comfortable. And basically for me, it helps me a lot, not just in my work, but just seeing myself in the mirror, sitting down and not feeling all that weight on me. Like it was disgusting, and I don't want to feel like that anymore. Because now when I take pictures, I have to go. I'll give you the best example. If you go on my website and you see the pictures of the wigs from the back, this is what I do to take that picture from the back. I'm not kidding. I go like this, so you see this.
Right. Okay. I
have to go like that to take the picture because it grosses me out.
Right.
So that's a little example of just me personally, I'm very insecure when it comes to weight, and I gain it really fast, and then I stress out, and I eat more, and then I get bigger.
Right.
It's a mental thing that I need to change on my own. Lipo's not going to fix that, but it helps a lot.
Right. Well, I mean, here's the cool thing, though, is like you gain weight wherever you have fat. So although you've gained weight, I know that you feel like you see it in the stomach, but your stomach's not that big. So you really haven't gained much back in that area.
Not a lot.
Right. So wherever you've gained, you gain back wherever you have the fat cells, which, you know, in your case is on your upper body and your lower body. It's not so much in the midsection.
For a year and a half, for how much I've eaten and how bad I've been, I've only gained 10 pounds, which is not like crazy.
Right.
But it's not bad. I've noticed like it doesn't really go here. It took a while for it to start getting there. But I noticed that the fat doesn't go how it used to. Like before, I would eat and right away, within a week, this thing got huge. So for being an entire year, only 10 pounds is not bad.
Yeah. Well, I mean, the fact that you gained 10 pounds, to me, it's impressive that you don't look 10 pounds heavier.
Thanks.
You know? And I think once we take care of...
It's in the arms.
Yeah, well, I mean, once we take care of the arms and the upper body, the only place where you're going to gain weight is your lower body. And your butt. And your boobs.
I'm hoping it goes to the booty.
Yeah. So, I know that... I know you said you like the legs. So, that'll be your biggest part of your body once we take care of the upper body. So, it may not be proportionate. However... I know. I was just talking to someone today, and that's like a look that girls like.
Yeah.
They like the thick bottom and the thinner upper body. So I mean, if that's what you like, then that's cool. But
I told Darren. Darren was like, "Oh no, you better not touch your thighs."
Well, here's a thought though, with the butt, because you have a good sized butt, and it kind of it'll blend into the surrounding areas. So that's why when we took care of the lower back, it created the shape. Well, the same thing on the side of your thighs. If we take away the sides of your thighs, I can literally carve out and shape whatever shape butt that we want. And for you, you have a lot to work with, so it'll be a nice, round, perky, like exaggerated butt, which it could be pretty cool. So just a thought.
Hey, I'm open to any ideas. After seeing what you did here, I'm totally open to anything. But I think for me personally, I feel like doing it all at once would be tough. So I think for me, like I did this and the back, and then since this time it's just gonna be like just a little bit here and mostly the arms. That's like good for a day. Yeah, no, I like to break it up and actually when we do because people come in for full body liposuction all the time. So I like to break it up into 3 different procedures where we address the upper body, the midsection, and then the lower body. And if we can keep it in 3 different procedures, we can get very aggressive and get great results, and tends to work out well. But also when people try to push too much, you're sore all over, and it's the recovery is more difficult, and you have more challenges. So some people try to do it, especially the ones coming from out of state. Definitely. So a lot of people are asking. So he's in Nevada. So my shape lipo is Vegas.
Right. Vegas.
I know everybody. You say Nevada, and they're like, what?
Right.
Vegas. He's in Vegas. For me, it's a 3-hour drive. So I'm going to be driving there, and then I'm probably going to stay around a week in a hotel just because I'm sorry, Trevor, I'm the kind of person that I'll keep going back and be like, is this normal? Is this normal? Am I okay? Like, is this good?
Right.
So I wanted to make sure that everything is good, like that I'm healing right, that I'm leaking correctly.
Yeah.
I know some people leave the same day, which, hey, good for you. That's awesome.
Right.
One of my close friends got lipo, and she literally drove back to Arizona the same day. And I was just like, you're crazy. Like, you're insane.
Yeah.
So everybody's procedures are different. Everyone's recovery times are different. Like Tiffany's a friend of mine as well. She went there. Her recovery was way faster than mine. I was just like, hey, compared to working out. And I know, like, lipo has that negative stigma, like, oh, do it the natural way, go and work out. For some people, it doesn't work that way.
Right.
For some people, it's super, super hard, and it's discouraging, especially when I did try working out, and then I would go live, and people would be like, oh, well, you're fat and all this stuff. And I'm just like, well, thanks, jerk.
You love the haters, right?
We've been trying. So for me, lipo, like, they shape me. Even when I work out, doesn't mean that my body's going to shape the way I want it to.
Right. Hey, I don't know if you realized it, but you single-handedly popularized the term 360 lipo.
Really?
And I don't know if you were the like made it up, but whoever made it up, because I think someone like maybe it was one of our followers like started saying that term and then it just caught on, but it was really after you because you were
because it's 360. It's like,
yeah,
you
it
know,
was all the way around.
360.
Right. It makes sense. And, I mean, you weren't the first one that I ever did that to, but it was like the first one that people started saying 360 lipo, and then that term is stuck. And now it's kind of crazy because almost I would say 70% of the procedures that I do now are 360 lipo. And
Okay.
the results are freaking amazing. Like just like with yours, I'm turning these people into like Barbie dolls, and it's the coolest thing ever.
No, and like sometimes even when I'm walking around, like Darren's just like, that guy just looked at you. And I'm just like, okay.
Chill out a little bit, Darren.
No, but it's awesome. And I know, let me see, why does she have to have lipo again under her boobs if she already had 360? So my 360, we didn't do the top. We mostly did bottom, sides, and all this back.
Mm-hmm. So
didn't do the top.
Yeah, sometimes okay. So like the area when it comes up just under the boobs, it's difficult to get a lot of. It's sometimes there's an issue. So sometimes it just needs to be redone. So liposuction, people just have to realize that this is an art, and it's not like an exact science. It's not like everybody gets exactly the same. It's never exactly the same. Everybody's a little bit different. Everybody's body's a little bit different. So my ability to get consistent results has been through the same techniques, in that as I have issues like this, like leftover fullness in the top, I see that kind of stuff, and then I purposely I make changes. So I continue to improve. That fullness up there, it's something that I've seen plenty times in the past. It's just difficult to get it right. So sometimes you have to go back and clean it up a little bit, but it's a minor thing. It's not that big of a deal.
How much did you weigh before your lipo? I was in the 180s. After lipo, I was in the 160s, and now I'm in the 170s. I know. I know. I'm sorry. But I want to be completely, as honest as possible with you guys. Like, yeah, I messed up, and I own up to it. I started eating bad again, and I forgot about it, and then I started looking at myself in the mirror again, and I was like, oh, dang it.
So, what's your plans now? What are you gonna change in the future?
So Darren is definitely gonna help me, and he has helped me already, and people get so mad at him, and I feel so bad when he stops me. But I need to just focus on what I want to do in the future, which is I want to focus more on my music side. And when it comes to music, I feel like with music videos and stuff, I'm gonna be seeing my full body a lot. I can't just hide it in the live video camera where it's just this here doing my makeup. It's gonna be showing my body. And I need to decide if I want to stay healthy or not. Because even though I have lipo and I'm skinny, I need to also worry about my health. Right. So I can't just be eating like that anymore. I have to just control myself, focus on what I need to do. And yeah, but just know, you guys, Monday I am eating really bad. This is my last day. Trevor. Well,
Angelica, I know that your career is taking off, and you're growing from your level of influence, and I think this is an opportunity for you to go from the girl that's just the face to the full body, and I think like you were saying, getting these other sponsors that have you doing clothes, this is going to open up a whole new venture for you, and hopefully in a year from now or 2 years from now, you can say my business is quadrupled because now I'm doing X, Y, and Z that I didn't ever feel comfortable doing before. That's what I would hope. And now you're a music superstar, so
I'm so nervous. And I'm waiting until after lipo too to release that first song.
Right. So when you were in Puerto Rico, was it just the audio recording, or did you do video stuff? Okay. So you haven't done any of the.
I did all the vocal recordings and stuff out there. I came back, and then I'm hoping to be able to go back after the surgery. I want to say maybe in a month. Go back and do some videos. Okay. Music videos out there.
Cool. Puerto Rico, right?
Yes.
Awesome. That'll be fun. How'd you like it out there?
I loved it. I had a blast. I wish I would have had time to hang out with like my family more and kind of like relax. But it was just, everything was so like fast paced.
Right.
Work, and then go back home.
Yeah.
And work. I'm here too.
Let's see. So I'm just.
Thank you, Marissa.
You see any questions or anything?
A lot of people are asking about pricing.
Okay. So any of the people that pricing. First of all, we're very transparent. All of our pricing is on our website for all the different services that we offer. However, it's really what it's going to cost you is going to depend on what you actually need. And we do offer free consultations. Those can be done over the phone. We're now starting to do video consultations to make it as easy as possible for you people. Most of our patients are flying in from out of state, so you can come in, get your procedure, and fly out within just a few days after the procedure. I know Angelica said you're staying for a few days, right?
Yeah.
Okay. So it's up to you how long you want to stay, but it is possible to get it done quickly and get back. It kind of depends on what you do. If you're going to be doing a lot of stuff, I recommend staying a few more days. But we try to make it easy. And don't forget, any of the people, any of your followers, just make sure you guys start following us on MyShape Lipo, so you guys get updates, and we'll be live during this procedure, your procedure, next week. That's crazy. It's coming up so quick.
Stop. And yes, you guys, so I am going to be awake. I know some people are asking about, like, if I'm going to be under anesthesia, how I'm going to be live. I'm going to be awake the entire time. So you guys will be able to talk to me as he's, sucking my fat out. I'm going to be raffling out the bag of fat. I'm just kidding. I'm just kidding, but I would totally keep it if I could.
Well, we'll get pictures of it at least.
They're asking if you do payment plans. Do you do payment plans?
Yeah, so we have so we have a couple different options. There's a finance company that we deal with. It's a third-party finance company, so it takes a little bit of time to get approved for that. We also have kind of like a layaway program where you can make payments, and we essentially hold the money until you build up an account large enough to pay for the procedure.
Then do you offer skin tightening and stretch mark fixing?
So the skin tightening we use, the Smart Lipo, if you've heard that term. Smart Lipo is a brand of laser that we use, and it helps us to tighten the skin. It stimulates collagen growth, so you get up to 57% more skin tightening when you use a laser versus liposuction alone.
Will you be doing that on my arms?
Yes. Definitely.
Yeah. What did he just say about the payment plan? So they do offer a payment plan, yes.
Yeah. Yeah. So the next step, if anybody's ready, like
do you do BBLs?
What's that?
I think you do fat transfer to the butt.
Yeah,
Right?
yeah, BBLs. Yeah, so BBL is very popular. Fat transfer to the butt. So we take fat from anywhere on your body and transfer it into your butt or to your breast. And I saw someone that was asking about the eyes. We can also do fat transfer to the face as well. So that's possible. Essentially, you can take fat from anywhere on your body and you can put fat back in any part of your body. So I mean, it's not like there's limitations on that kind of stuff.
Chin lipo. Yes, he does chin lipo. I've seen it on his face before too.
Yeah, it's awesome.
I feel like I don't have much here.
No.
So I think I need it. Do you have to be a certain weight for fat transfer?
Well, we have to have fat to take. So if you have no fat to take, then that's going to be an issue. So yeah, you have to. It's not that you have to be a certain weight. You just have to have enough fat for us to take and make a difference.
Trevor did my chin lipo, really?
Oh, I did. Is that somewhere like that?
Do you love your new chin?
Yeah.
Take all of mine, please. I know, I would donate too if I could. I feel like everybody would donate that. How can I make an appointment? So just schedule a free consultation and then you'll go from there.
Yeah. Yeah, so the next step, if you have any questions about pricing or the procedure itself, the free consultation is the next step.
So is Smart Lipo included with 360 Lipo?
It's not included. So we break things up. So we charge per area for the liposuction. You may not need the smart lipo laser, but if you do, it's an additional fee. So we try to break things down. So some individuals that are more budget conscious can still get services done like liposuction. If you just get liposuction, that would be the cheapest way to go. But if you need skin tightening, it's a little bit more expensive for the laser, but you may or may not need it. If you want fat transfer, that's an extra service as well. All of it we break down, so it's pretty easy to figure out the cost. And if you compare us to most of the places around the country, we're very competitive. Especially considering that this is all I do, and I've done thousands of these procedures, so I think it's a pretty good deal.
Someone asked, Rosalie asked if you do the BBL awake as well.
Yes. Yes, everything. We don't do any general anesthesia here.
Okay. Fajas, how they work, foam sports. So I ended up buying my own fajas because, so basically, like the wrap that he provides, after a while, it looks so disgusting from my leaking that I just ended up like starting to look for some that worked for me. Like there's some that were too long for me because of my torso. So for fajas, like, and I'm gonna be showing you guys on my clothing haul later today, kind of like the stuff that I bought for my after lipo procedure. So I'm gonna need shower curtains for the hotel bed. I brought different fajas. I got arm fajas for after we do this. So I wanted to show you guys like the stuff, like my prep, basically. So I got a lot of clothing that I can just kind of step into, and Darren can just pull it up. Because I haven't done my arms yet, so I don't know how that recovery is going to be. So I'd rather just like step into something and then just whoop. So I'm going to be showing you guys kind of like the stuff that I'm going to get ready for that lipo.
Right. I know that you said that you're. It's kind of funny because it's hard to tell, but I know you always say this. You're such an anxious person and nervous, and and you said it was a challenge. But I mean, you go through this stuff like you're a champ, and you make it look like it's so easy. So it's deceptive. I think.
So I don't know why. Okay, so you guys. So the thing that makes me nervous, and it was the same thing that made me nervous the first time, was when he actually like puts the thing in for the first time, but I didn't even feel it. So I was just like, oh, okay. But for some reason, like in my head, I'm just like, when he puts it in, like it's gonna hurt. But you don't feel it. The only thing that you do feel, that I felt during the procedure, was pressure. Like it feels like pressure, like someone's going.
Uh-oh.
Just start it over again. I think it's over an hour.
Did it go over an hour?
I don't know.
No, I don't think so. It seems like it's internet connection.
Okay.
That's weird. All right, so we're a little delayed here on Instagram. Angelica. That's a shame. So sorry about this. We're just having a little technical difficulty here. We're still on Facebook here. Looks like people are jumping over to Instagram. Huh. Can you guys hear me? Is it just Angelica? I'm trying to get through all these comments. It froze, it paused. How do we unpause this?
Maybe you might just have to restart.
Are both of them frozen, or is it just?
Yeah, I think it's just her.
Is it just her?
Because you're okay.
Huh.
You go look at the computer.
Video paused. Sorry for the delay. Well, if you guys can hear me, if you have any questions, I'd be happy to answer any questions while we're waiting. Okay, I'm getting the BBL, local anesthesia. Am I worried if I end up feeling and not being able to? So, Natalie says you're getting the BBL under local anesthesia, and you're worried about feeling something and not being able to talk or move around. So you're awake throughout the procedure. So if you feel anything, you just let me know, and we put some more numbing medication. It's that easy. And we do our best to keep you as comfortable as possible. So you just let us know. Try and keep it easy. Okay, I don't know if you guys can hear me. Can anybody, Can you guys hear me talking? Or am I just talking to myself? You can hear me, Rosa. See, they can hear me on Facebook. Rosa's there. We only got one person on Facebook.
It's like Instagram. You're done.
We're done?
Like it froze.
That's it?
Yeah.
Okay. So you can't even hear me at all?
Yeah, can.
Okay.
You're a big blur, so just turn it on and off and start over again.
And live. Okay. Let's see. How do we go plus? Sorry, Rosa. I appreciate you there on Facebook. You wanna? Okay.
Live.
Go live. Okay.
Okay, you're back.
What's up? Okay, so we're back on Instagram. Sorry, I'm trying to. I know those of you on Facebook. I was trying to do a joint video with Angelica Torres, or Candy Lover. She's one of our influencers on Instagram, and so she's coming back for her second procedure. Let's see if we can get Angelica back on here. It froze up on us, so I apologize for that. Just trying to get this figured out here. What's up, Carol? Appreciate you guys jumping on Facebook. Okay. Angelica, if you can just, if you see me here, if you could just leave a message so I can bring you back on. There you are. Okay. There you go.
I'm back.
I was like talking and talking and talking and.
So was I. I was like having a whole conversation.
Yeah, that's funny.
And my mom comes up and she's like, "You're frozen." I'm like, "Oh."
and we're just talking. Technology, it's awesome, right?
Gotta love it.
Right. So where did we leave off?
I don't know, because I was just rambling on.
I know, me too. So someone asked if they got their BBL, and they were worried about if they were moving around, or they, like, if they felt something, that they wouldn't be able to say something. So, obviously, you're awake the whole time. So if you do feel anything, you can always let me know. But if you want to speak on from your experience.
Yeah. So when I was getting the lipo, like I would tell him, like it would feel like strange, like especially towards the rib area. I feel like that's where I felt the most pressure personally. So I would tell him like, "Oh, can you add a little bit more like of the numbing there so that I don't feel it as much?" Because it just feels like pressure and it just feels like awkward. I can't even describe the feeling. It's like, but it doesn't hurt.
Right.
Like I was literally texting you guys. I was responding to people. I was live on my Instagram while they were live on Facebook, and we were just talking. We were talking about like random stuff too. Like it wasn't even like we were just doing the procedure, and after the numbing starts to go off, that's when you start getting really sore, and I just wanted to sleep all day long. So this time around, I promise you guys, no matter how horrible I feel, like if I just want to sleep all night or all day, I'm gonna tell Darren to still, post in the stories so you guys see what's going on and film for YouTube as well. Right.
No, I think it's important that people realize that it's never exactly how you expect it to be. So it's always going to be some challenges, and you're going to have to deal with those challenges. But the bottom line is it's worth it. Whatever.
Yeah.
Whatever you have to go through, even if you're like out of commission for a week, it's totally worth it. But that's not the case. Most people are up walking around. Most people are able to get out and do things. So I think I think you'll be surprised. It's not as You can do it.
You have to go back 2 times? No, you don't have to. I don't have to. I want to, because I want to do different areas now and work on other areas that I kind of want just gone.
Let's see. So someone's asking about a nutrition plan for after. And some people use lipo as a quick fix. So they're asking like what really makes the results last. So
it depends on the person, I think.
Yeah. So, I mean, obviously, you know, like I'm not a nutritionist. However, I've personally studied a lot of these things and I've made choices for myself. But I mean, there's so many options out there as far as diet, and there's so many like ideas and beliefs that, I mean, like really, you got to do whatever makes sense to you and what works for you. And the truth is there's not one diet or anything that works for everyone. So you have to try a bunch of different stuff.
Wouldn't all that money be better invested in weight loss surgery? This is weight loss surgery.
Technically, yeah.
Quick.
Yeah, I mean, you know, wait. So let me just explain a little bit the difference between probably what they're talking about is something like the sleeve, where those type of things
That's dangerous.
they actually restrict your stomach. So instead of your stomach being like the size of your fist, it's like the size of like this, like a marble.
Mm-hmm.
And so the only reason you lose weight is because you're not actually absorbing any nutrients. So if you think about that over the long term. Yeah, if you're not absorbing nutrients over the long term, it causes problems. So those people have to take supplementation. They end up getting medical problems. So there's all kinds of issues with that. That the reason not to get that type of surgery, but liposuction is it's so safe and it's so easy. And you know, once the fat's gone, it doesn't come back. And I know you said you gained weight, but there's not that much fat in your belly to be able to get big again. It's gone. You know, you have a little bit left in there. So if you gained weight, I always tell people you have to work really hard to gain weight in the same area. You know, it's difficult. You know, it's a challenge.
And Erica, yes, he does do that area. Yes.
What area?
She's asking if you do the area down under.
The fupa?
You can do it like over there.
Yeah, they call it the fupa.
The fupa.
Fupa. Okay. So I see a couple more questions about cost, and again, you know, cost. All of our prices are on the website. We charge $12.99 per area for the liposuction, and $2,000 for the fat transfer process. But the question is how many areas of liposuction do you need? And so to determine that, we do the free consultations. So you can call our office, or Angelica has some links on. Is it on your profile? The link?
I think so.
No?
I think so. But if it's not, you guys can DM me and I can send it to you.
Yeah. And so, you know, there's ways you can sign up for the consultations. But basically, you're going to contact our office. We do our consultations. We can do it if you live locally here in Vegas. We can do the consultation in person, or we can do it over the phone. Whatever's easier for you. In fact, I know a lot of our locals are doing consultations.
I did mine through email. I had Darren just take pictures of me, like standing, front, side, and back.
Yeah.
And that's what I sent to them, and I did mine all through email.
Yeah. So I'd like to start doing video. And I just actually saw someone asking if they could do video, and you know, one of the issues with people sending in pictures is like they have to actually do something. And so you know how people get when they have to do something. So you know, some people drop off. So we're trying to make it easier. Like, don't send pictures. All you do is call us. You know, get on video chat or something, and we'll like visually be able to see you and give you recommendations over the phone. So I think that's going to be a lot easier for a lot of people.
Will skin sag after lipo? Mine did not sag, and that's something I was very worried about. And I told them that so much.
Yeah.
But no, mine did not sag.
Yeah.
And if the longer you wear your fajas, I feel like the better the results will be too.
Yeah. Yeah, as far as the skin sagging, obviously everyone's different. You're young, you didn't have really loose skin beforehand, and your skin tightened up really nice.
Mm-hmm.
Not everybody has the same potential as you, so you have to take everybody, you know, into account when they're considering themselves, because you know, everybody's worried about themselves. So, you know, we have lots of pictures, and there's lots of women for different sizes. You know, like we don't just show pictures of skinny girls; we show pictures of women from all different sizes, so you can kind of hopefully identify with someone that's similar to you, so you can kind of get some idea of what's possible for someone like you. But I think you'd be surprised how well the skin tightens up.
Yeah. Did it hurt when he created the holes? No. That's what I was most scared about. No, it didn't. Like, I looked at him and he was like, I'm already in there.
Yeah.
I was like, oh, okay. Cool. Do you get your own fajas? Do they provide them for you? So I ended up getting a few of my own because I needed them custom made just because of my short torso. So I did get some custom made, and this time, like I said, in about an hour, I'm going to be going live showing you guys some of the stuff that I got for the procedure for afterwards. So I got a ton of fajas, a ton of like clothing that I can just slip on and be comfortable and, you know, let my body heal on its own, basically.
Yeah. So we do provide the compression garments or fajas. We'll provide something that'll get you by. But if you want to have, you know, specific garments, then, you know, obviously you can get those separately. But we'll definitely give you something to get you by, and that will give you compression. It'll be sufficient. You know, these garments, there's so many different options, so it's impossible for us to carry everything. So the garments that we carry, they fit everybody, but they don't fit anybody really great. You know, so they'll fit everybody and they'll do the job, but it's not great. So getting something separate like those fajas, I know have done really well for people. Let's see, someone's asking about. Go ahead.
I keep falling. Sorry.
Someone asked about the weight in order to get liposuction in the BBL. So as far as the weight, there's no specific weight limits. So for example, like we treat patients that are 300, 350 pounds. So I don't limit the weight. You don't have to be any specific weight. We don't charge, you know, any more just because you have a specific BMI or anything like that. But as far as for the fat transfer, you just want to have enough fat to make a difference in the area. You know, so we need to take enough fat out to transfer back in to make a big enough change for you. So it's not necessarily about how much you weigh. It's just about how much volume, how much fat that we're able to get out of you. But 200 pounds for this individual, that should be plenty.
Yeah, your camera's frozen. We can hear you.
Mine is?
But we can't see you. Mm-hmm.
Okay.
We can hear you fine, but we can't see you.
Uh-oh. I turned the camera around. I was like, can you see me now or no?
No, it's like it's going like doing the little loading thing.
Or should I just start over?
You can, but I have to start doing my.
You gotta go. Soon. Okay. All right. Cool. Well, you know, you can go do your thing, and so you're gonna be back. You're gonna be in Vegas next week.
Yes.
And then we'll do another video before your procedure.
The pre-op.
Yeah. Cool.
And you guys keep your calendars marked. July 30th.
Right.
We will be doing that lipo. I will be posting on my stories and stuff, kind of reminding you guys. And yeah, but I hope you guys can go through that with me. Like, I need you guys for support.
Absolutely. And don't forget to follow My Shape Lipo.
Right up here, you guys.
And anyone who's ready, we can do a consultation for you and get you started on the process. Maybe you can do it on the same day that Angelica does it. Wouldn't that be cool?
That would be fun. I'd be down. They can do it first, though.
Right. You're funny. Am I still frozen?
Yeah.
Ah. All right. Well, we can end this. So I appreciate you jumping on with me. Were there any other questions? I mean, if you guys can hear me, we can definitely answer questions if you wanted to answer some questions.
Let me see. What will you use to go live for the procedure? So we'll probably be live either on my page or My Shape Lipo's page on Facebook, and then one of our Instagrams most likely.
Well, you know, we'll have a whole team there. We'll be live on every account that we have: YouTube, Facebook, Instagram. We'll be live everywhere.
Okay.
And we'll be on your accounts.
You're gonna see all my angles.
Yeah. Yeah, it'll be cool. You know, hopefully you'll be able to talk to the people during the procedure, answer questions.
Oh, definitely.
You know, I think that'd be kind of cool. It might be a little bit.
Somebody was asking about the drain. So when I had mine done, we left them open so that all the fluids would just kind of come out, and then my mom helped massage too. So it helped, and it was pretty quick. I stopped leaking, I want to say, on day 2.
Yeah. Yeah, so we don't use drains. So I think she's talking about with plastic surgeons, they actually put tubes that are sticking out of you.
Mm-hmm.
Yeah, so we don't do any of that stuff. The holes are left. The holes are tiny, so they're really small. They're about 2 millimeters, which is about the size of the tip of a pen. And those are left open on purpose, so then with gravity and the compression, it literally forces the fluid out. So you drain this fluid, which is, it's kind of an inconvenience, as you know. It can get messy, but it's way better than having these tubes sticking out of you. And then also, since we don't close the wounds, there's no stitches, so you don't have to worry about coming back here to get stitches taken out or getting an infection from the stitches. So it's really way better.
Definitely. So wait, what happened? Why is he not showing his face? No, the camera's frozen, but we can still hear him.
Yeah.
He was showing his face earlier. It's just technology.
Sorry about that.
Can't control it sometimes.
Yeah.
Thanks for answering about the drains. You're welcome. So you will be awake. Wouldn't that hurt? No. So you're still numbed. You still have the what is that called? Is it like local anesthesia?
It's called tumescent, but also local anesthesia. So what that means is we're putting fluid specifically in the area that we're treating. So only like for your arms, for example, only your arms are going to be numb. Everything else you'll be able to feel. So you'll be awake. And one of the advantages of that is people don't realize that when they put you to sleep, they're really they give you medications that stop you from breathing. So they have to put a tube down your throat and breathe for you. And so general anesthesia is extremely dangerous, and all the deaths that have occurred with liposuction in the past 15, 20 years have occurred under general anesthesia. So the technique that we use is substantially safer.
What are you getting done this time? So I'm getting my arms and then just little extra chubs that gotta go. Someone posted the address.
So someone says, are you gonna remove the fat and put it somewhere else?
No, I want it gone, like gone. Throw it away.
Right.
Make burgers out of it. I'll sell Candylover burgers. If you want a bigger butt and a flatter stomach, which is better to get, lipo or fat transfer? So when I had my lipo, they sucked it out of my back, and it made my butt look bigger just on its own. So I don't have any work done to my butt.
Yeah. And so the answer to that question is going to depend on the individual. If they have fat in their lower back, then maybe taking out the fat in the lower back would make their butt look better. If they don't have that, then maybe doing fat transfer to get the butt bigger would be necessary. So it obviously depends on the individual. But it's anything is possible.
Have you done? Yeah, I already did lipo with them a year and a half ago. So now I'm going for like the areas that we didn't do. How much does it cost? So all the prices are on their website, but I recommend you do the free consultation, because that way you can know like the areas that you specifically might want done or need done. But all the pricing is on the website, you guys, too.
Yeah. Let's see. So someone asked where in Vegas. We're actually located in Henderson. We're about 20 minutes from the Strip, just south of the Strip.
Someone, I think she's asked a few times if you can get the same procedure done twice in the same day.
How do you do the same procedure twice in one day?
Yeah, I'm not sure.
That doesn't make sense.
I don't understand the question.
The hope is that we get the fat out the first time, so you never have to get the procedure done again.
You don't have to do it again.
Right, especially not in the same day. But there are some people that want to get multiple procedures done. So like treating the upper body, then come back and treat the midsection, similar to what you're doing. All I really need is a week in between. And so that week in between allows for all the medication to get out of your system, so it's safe again to go back in for another procedure. Now, you may not feel up to it. Like you may be sore or not feel up to it, but all I need technically is a week. Oh, someone put our address in there.
Tanya. You can do the free consultation from Mississippi. Are you going to be in pain with any? I feel like with anything, any type of procedure, you're going to be sore after, no matter what you get done. Even working out,
Right.
just on its own, you're going to be sore.
You know, I was talking about this the other day, Angelica. The only people that are not in pain are those people in the cemetery.
Yep,
that's it. If you're alive, you're feeling some degree of pain. So live with it.
Exactly. But it goes away and it's worth it. For me, it was 100% worth it. Hi, Olimen.
Okay, someone asked if the anesthesia is like an epidural, and it is not. What we do is we actually inject fluid into the layer of the fat, so it fills the layer of the fat and all surrounding the fat, so it makes that area numb and allows us to take the fat out while you're awake. And the crazy thing is you're awake, but you're just not feeling it.
Mm-hmm.
And the advantage of that is afterwards, for 8 to 12 hours after the procedure, your head is still with it because you don't have all those heavy medications from general anesthesia.
Costosa, are you coming? Are you getting it done too? Let's do it. Let's do it. They do have financing options available. How long is the recovery? I think it depends on the person and what you're having done and everything.
Yeah.
Did you get your lipo? I had lipo a year and a half ago, and I'm going back July 30th. So Tuesday, we go back in.
Yeah. So,
I think Darren is more nervous than I am.
Is he?
Because he has to take care of me. Yeah.
Let's see. Someone asked, how does the fat transfer work for breast augmentation? So I'm not sure if they're asking for, because technically fat transfer to the breast is considered breast augmentation, but if they had implants in there are some people that want fat transfer and they already have implants. So I'm not sure exactly what they're talking about, but we can take fat and put it into your breasts, obviously, and make your breasts larger. And on average, people are getting about 1 cup size increase. But the people that I've seen that benefit the most from the breast fat transfer are those like the moms that they've lost volume, and they kind of, it's particularly on the upper part of their breasts here, they kind of get that, how they get that swoop where they're like the nipple, like it looks like a slide almost. So they lack that volume up top here, so we can actually fill the volume so it makes it appear like your breasts are sitting up higher on your chest. So it kind of gives that lifting effect to it without actually cutting and pulling.
Tanya says, I can get the cash. I just need to get over the fear. Girl, I'm scared when I look in the mirror and the arm's just like, boom.
Right? What's scarier, right?
That's scarier to me. I'm like, I'm young. I want to look good like now.
Right. Okay.
So I would say if you want to do it, I don't know, if you're like not happy, like when you look at yourself and you want to go for it, girl, go for it. I know Costosa said that he called to see if you guys had another day available, and you guys have the 31st. So
awesome.
Hey,
there you go.
I'm so down.
Yeah, that'll be cool.
I will wait for you in the waiting room like this.
Yep. You'll support.
Group work. Support. If anybody wants to go, I'm telling you guys, if you guys get it done, I will be there. I'll be like sitting there, but I'll be there.
We'll have a lipo party.
Yeah, oh my god, that actually sounds so fun.
It would be cool.
And one thing though for sure is I need to remember to eat breakfast.
Yes.
Because remember, I didn't eat breakfast.
Yeah.
Because usually when it's like a procedure, they tell you not to eat. But for like this, you should eat so you don't get nauseous.
Yes. Yeah, so we give you some oral medication. So if you don't have anything in your stomach, it can make you nauseous. So and this is different. Like with general anesthesia, the reason why they don't want you to eat is because if you vomit during the procedure, you could breathe your vomit, which they call it aspiration.
Choke, right?
Yeah, you choke. So that's just not an issue here. If you throw up during our procedure, we're gonna tilt you over to the side and you'll throw up into a trash bag. That doesn't really happen very often, but definitely eat before the procedure.
Yeah. Keeping you in my prayers. Oh, thank you. So someone says, I suffer from severe anxiety. What should I do?
So anxiety, we do have anxiety medication that you can take, and it makes you kind of drowsy and lightheaded. It's called Xanax. Many of you have probably heard of that. So someone asked about having the Prego pouch with lipo. Will it sag even more? And you know, typically when we take out the fat, it always retracts back, and this is kind of a physics thing. Once you just think of it like a balloon, like when you reduce the volume of a balloon, the balloon always retracts back. So your skin is the same way. When you have fat in there, it's stretched out. When you remove the fat, it shrinks up because the skin naturally wants to be tighter. Now, how much is it going to retract back is going to be different for each individual. So with you in particular, it retracted back phenomenally well. You don't have any kids, you don't have a lot of stretch marks down there, but it retracted back quite nicely. Other people who have a lot of stretch marks, it may not retract back as well. But here's the truth, is you just don't know. So I wouldn't assume that you need a tummy tuck when you can still get the results with the liposuction. It may retract back quite nicely for you. So I would say my recommendation is worth getting the liposuction to see if you can avoid having the huge scar or the tummy tuck.
No, definitely. That's what I didn't want.
Yeah.
Because that scar is from side to side. These, most are gone.
Yeah.
I don't even see some of my little dots. What if someone passes out during the procedure?
Are they talking about the patient or like someone in the room?
No, like the patient.
Oh. If you pass out, you wake up. Like that's some people.
Wake up skinny.
Yeah, you'll wake up skinnier.
I think there was another question. Let me see. I thought I'd seen one more, but I don't see it.
Someone asked about breast augmentations again. So just clarification, breast augmentations technically is just making your breast larger. So a breast augmentation can be done with implants, which we don't do, or it can be done with fat. So we do fat transfer. So we can make your breast larger by adding fat to the breasts to get you, and it's really nice because it's a much more natural look and feel in comparison to implants. And also the scars are substantially smaller. Again, we go through the same tiny little puncture holes, so they're 2 millimeters. So you can get larger breasts and have tiny little puncture holes that no one will ever see.
Are you scared? I'm not scared. I'm more like anxious. Like I'm just anxious. But I'm not scared. Like I said, I feel like I was scared the first time because I'd never done something like that. Mm-hmm. But now I kind of know how everything goes. I'm just more anxious.
Right.
Do you have to lose weight first before getting lipo? That's what I asked, and I didn't have to.
Right.
Right.
No weight limits.
Am I right?
Yeah, we don't limit that at all. So the liposuction. So the reason why people ask that is because everywhere else they go, they charge extra for if they have a certain BMI or if they're not their ideal weight. The doctors will tell them to lose 30 pounds and come back. So we don't do that at all. If you have fat, I can remove it. And if you're larger, like you're 300, 350 pounds, we can still do liposuction. You just have to be realistic with what the expectations are, and also you may need to get more liposuction done just because it's simply a larger surface area. So, but it's not going to stop me from getting the fat out of you. If you have fat, we can suck it out.
Someone said, do we have to be sober prior to surgery? I heard you're supposed to be clean. I personally think that when you drink alcohol, it dehydrates you. So
it also thins your blood, so it's not recommended at all to drink alcohol. And then after the procedure, the antibiotics as well as the pain medication, they do not go well with alcohol. Medical marijuana is a different story. Whole new ball game, different rules. And it's legal here in Vegas.
Is it now?
Yeah. Recreational, so anybody can just walk in and buy.
Oh my gosh.
Another reason to come to Vegas, right?
Yeah, some people are asking that. They're like, what about weed?
Yeah.
Wow.
So someone says, will you get the same results from lipo as if you were being put to sleep? So here's the cool thing is that they're actually way better, and I'll explain why. When they put you to sleep, they can't move you around and get you in the proper position to get the best results. So when you're awake, like if I need you to turn or twist to give me a better position to get better results, you can just simply do that. When you're in the operating room and you're asleep, it's a huge nightmare to turn you from like your back to your side or to your other side. So what they do is they just don't turn you. They try to get by with whatever crappy position they have. And so because of that, the results aren't as good. So in my opinion,
that's when I remember when he did my 360,
yeah,
he told me the same thing. Like he'd be like, okay, I'm going to need you to move to the side. And I'd be like, oh, okay.
Yeah.
So he could get into those like areas because you still have full control of your body. You just don't, you're just numb. Right.
Yeah, you have to be able to move. It's really important. And you know, I am very aggressive, but if you're in the wrong position from my standpoint, it can be extremely difficult. And what happens is when it gets frustrating for the practitioner and it's difficult for us to do it, we just do less. You know, if it's challenging, we just, well, it'll be okay. You know, it was hard, but that's not good for you. You know, like you don't want to hear that as a patient, right? So it's important that I can get you in the right positions and that I can do the job that I'm supposed to do to be able to get the best results.
The pain, how is the pain? So for me, basically like the first day, I just felt super, super sore. Like I felt so tight. My body's just not used to feeling that tight. So like I was like trying to like stick my stomach out like I normally used to do, and I couldn't do that anymore. So it feels weird, but it's more like soreness. Like you're just very, very sore. Mm-hmm. So like for me to get up, like Darren would pull me by my arms, and I would kind of like stand, go do my business, go to the bathroom, whatever, and then I would just want to like lay back down. So I feel like for me, like the first 3 days, all I wanted to do was just lay down and relax.
Yeah.
I didn't want to be too hard on my body too, because it's healing. It's trying to do its own thing.
Yep.
And you're getting used to it too.
Yeah.
That's just me, like my personal.
It takes
recovery.
It takes a while to get used to, right? I mean, it's because I've had lipo too.
So when when I would put the faja on, I feel like I lived in the faja. Like I needed the faja because when I would take it off, I felt like my whole body was going. Ugh.
Right.
But it wasn't. But
right.
I got so used to like that tight feeling.
Yeah.
So I liked having that faja on. It made me feel like I'm good.
Like you're secure, right?
Yeah.
Yeah, a lot of people say that because like when you take it off, it feels like everything's kind of like your body's like your skin's falling off you almost. Like you keep it on tight.
I'm like my insides are like out, but they're not.
Yeah, it's so weird, the sensations. Like for me, like I couldn't really explain how it felt. Does that make sense?
No, 100%.
Yeah.
I can't either.
So everybody asks. But it doesn't. Nothing I say is going to make you understand how it feels. You know, so that I don't think there's anything that you can say that's going to actually make people understand the way it feels, because you don't know until you try it.
Definitely. But I will say it was much easier than my boob job. If that helps. If that helps. Because for my boob job, I couldn't do anything for 2 weeks.
Right.
With the lipo, I want to say, so I was in Vegas for 4 days. I was there for 4 days, and then right after that, I had to start shipping. So as soon as I got back home on day 5, I couldn't like completely bend down, but I was at my desk working. Mm-hmm.
So Tanya is asking about, she has a herniated disc in her neck, and that shouldn't be any problem. And any other people who have questions about like their medical conditions, for scars, for example, like C-section scars, that stuff, it's a challenge, but it doesn't bother me. I've dealt with, you know, thousands of people with those issues, so I have lots of tricks for that. But any other medical conditions like diabetes, or you have heart disease, or HIV, you've had cancer, or like anything serious that you're concerned about that, you know, can you still get liposuction? I'm always going to ask that you speak with your primary care or the treating physician, because only they know your condition, and they can verify and let you know whether you are able to have a procedure like liposuction.
And Flora Marie, I think you already asked this, why surgery, why not just diet and exercise? That unfortunately does not work for everybody. And for me personally, especially my arms, I will lose weight pretty much everywhere else except my arms. I've always had large arms, even when I weighed 110 pounds when I was like younger. It doesn't work for anybody. For everybody, I mean.
Right.
So that's just me, and it's my body and my choice. If that works for you, that's great.
Yeah.
That's great. But for me personally, it's not as easy. I'm always working, I'm always busy, and it's hard for me to make time as well. Mm-hmm. And sometimes when I'm out, a lot of like brands will be like, oh, we're taking you to dinner. And I'm just like, oh, okay. But yeah, it doesn't work for everybody. And for me, lipo, it's just another option. It's just like exercise and diet. You're still going to be sore. You still have to.
Great.
You still have to commit. It's not an easy decision. But for some people, it's just an easier, faster decision. Like I said, I don't have the time to work out, and the diets do not work for me, unfortunately, and I've tried. Mm-hmm. I've tried everything, and Trevor knows this. Yeah. I've literally broken down on the phone with Trevor, like explaining to him how I felt about my weight.
Yeah.
So it's easy to tell somebody, do this and do that, but everybody's body's different. Everybody's metabolism is different, and what works for you might not work for somebody else.
Yeah.
It's not nice to just shut somebody down because it's not something that you personally don't believe in.
Right. No, you know, I always tell people, by all means, if you can do this with diet and exercise, do it. Sure. Mm-hmm. But if you can't, or you tried it and you failed, like every other person on the planet, you know, liposuction can help. It's an option. You don't have to do it, and if you don't if you don't want to do it, then don't do it. But don't put someone else down for wanting to do it, because it's just a tool. That's all it is a tool.
Exactly. And my decision doesn't affect anybody else's
way
of life. You know, me getting lipo doesn't affect anybody else's anything, you know? So I said, I can't, I'm lazy. That's okay. Some people, you know, there's a lot of like moms and stuff, and you know, sometimes you have to take care of your kids, and you work on the side, and you have all this stuff going on, and you just don't have the time. And when you do have the time, and I know that feeling, I just want to sit down and watch TV and just relax with my boyfriend. Mm-hmm. When I do find time for myself. So sometimes you just don't have it, and you still want to look good.
Right.
And that's okay.
Yeah. Yeah. Well, you know, the other thing that I tell people is, like, even those individuals that there's some individuals that even though they lose a substantial amount of weight, they still have like a pouch in their belly, or the guys like they lose weight but they still have like those man boobs.
The way you want
it. So with liposuction, we can take out in those areas where you don't, like if you have that little muffin top, or you have a little pouch down at the bottom of the belly, like you can lose all the weight that you want and get to your ideal weight, but you still have things that bother you. So, you know, liposuction can do, you know, take away fat in areas that no matter what you do, there's no way that you can get that, you know, get rid of it.
Exactly, Erica. But hey, Trevor, I have to do my makeup.
Yeah. Okay. No problem. Thank you for jumping on.
So you guys, if you guys want to talk more about the lipo, I'm gonna be putting my link for my Shape Lipo on my Facebook video as well, so you guys can get more info on it. And I'm gonna basically show you guys my choices of wardrobe for that lipo recovery and stuff like that. So if you guys want to see that, I'm gonna be going live in about 40 minutes.
Awesome.
I just have to get my face on.
Okay.
Put my clown mask on. Just kidding. Okay. All right, Trevor. I don't know if you want to stay on.
No, I'm good.
You guys can. Are you okay?
Yeah, I appreciate you. I'm tired.
All right, you guys. So I'll see you guys in a little bit. And Trevor, I will see you probably either Saturday or Monday for our pre-op video.
Yeah. Let me know when you get in town. We'll meet up.
Okay.
All right. You have a good day.
Bye, guys.
Talk to you later. All right. So any of you who are still there, please make sure that you like the My Shape Lipo page, and I'll stay here for a few minutes if you guys have any specific questions. See if I can answer those for you. Let's see. Okay, do you guys see any questions? Okay.
Not working on that one.
People should. Am I? They said I was. I'm not frozen still, am I? Okay. I'm trying to see if there's any specific questions. How much is the average cost of liposuction? So, we charge per area. It just depends on what you want. You can get a procedure for as little as, I think it's $2,500 would be the cheapest. And it could cost upwards of $10,000, $11,000, $12,000. Just depends on what you need or what you want. Yeah, as far as the diet and exercise, I highly recommend, look, liposuction doesn't take the place of diet and exercise. You should continue with whatever diet and exercise you're doing. And in fact, after liposuction, you need to continue to maintain your results and get better results. You'll get better results if you continue to lose weight. Thank you guys for jumping on. I really do appreciate it. Any other quick questions? Don't forget to follow My Shape Lipo. I do these videos once a week, and we answer questions. So if you have other questions, you'll be able to get me on the live videos as well. I also have previous live videos on Facebook that are saved that you can watch. I have videos on YouTube that answer all the commonly asked questions. So the answers are there. You just got to search for them a little bit. So thank you guys for watching. Have a great day, and I'm going to be talking to Angelica. We'll probably go live again either on Friday or Saturday, and then her procedure will be next Tuesday the 30th, and we will be live during the procedure then as well. So don't forget to tune in. We'll be sending you some reminders, but stay tuned. Thanks again for watching. You guys have a great day. Cool. Shit, I went live on my personal page instead of My Shape Lipo.
Oh no.
Fuck.
Inside this time. Yeah. Trying to make everybody seem like we have a cool office.